Welcome to the Brave Feminine Leadership interview series, where I get to dig into delicious conversations with global leaders and we get to soak up their wisdom and perspective on all things life and leadership. Today, I'm absolutely thrilled to be joined by Todd Harper. Todd, welcome to the conversation.
Great to be with you, Melissa.
Brilliant to have you here. Let me touch on your bio for people in the audience who haven't had the pleasure of coming across you before. So, Todd Harper is a public health leader with over 30 years' experience in cancer prevention, research and advocacy, tobacco control, HIV/AIDS, and non-communicable diseases. As the CEO of Cancer Council Victoria since 2011, Todd's led major advances in cancer screening, tobacco reform, and patient support. Todd has held global roles, including Director and President of the Geneva-based Non-Communicable Disease Alliance, and is currently a Director on the board of the Union for International Cancer Control. Todd's contributions have earned him an AM in the Order of Australia and an honorary doctorate for his contributions. Todd, so wonderful to have you here. I would just love to ask you, who are you as a human being and how did you end up leading the Cancer Council of Victoria?
Yes, thank you, Melissa. Well, I suppose it's been a journey of sometimes unexpected twists and turns. I'm not the one to sort of logically plan out step by step every career move that I might make. I'm more captured by the moment and what feels good at that particular point in time. And I remember, for example, when I went to enrol at the University of Tasmania, I discussed with my parents about enrolling in an arts degree and what subjects I was going to do. And then when I got to the university and saw the length of the arts degree queues, I was a little bit horrified, but noticed that the economics queue was much shorter. And I thought, oh, economics, that sounds interesting. So I jumped in that queue, enrolled in economics, went home and spoke to mum and dad about it. And how did it go? Yes, it was fine. And you enrolled in arts and the subjects. Oh, actually, I enrolled in economics. And I think back on it now, they must have been slightly horrified at, all of these plans had been thrown away in an instant, but they never let on.
Yeah.
And then I also remember I'd always wanted to be a journalist, and so wrote to the editor of the local newspaper when I was in primary school, and then 10 or 15 years later, I was actually sitting across the desk from him, being interviewed for a role as a journalist. And I think about that sometimes because being a journalist, having an economics background, they weren't necessarily skills that I use today, but they did in many ways shape what has been really important in the work that I've done, understanding the value of investing in some areas as opposed to others in healthcare, understanding the value in communications, particularly on where you're talking about encouraging people to adopt behaviours or avoid behaviours that might affect quality of life or even save lives, and how we communicate those in a way that enables people to see the benefit and feel empowered to take up those actions is a really key part of the work that I do today.
Amazing. So you've dedicated your career, and we'll get into some of those moves because this role isn't your first CEO role, but why health? Is there a story behind why you've dedicated your career to health?
I think early on in my career, I was fortunate enough when I was working as a journalist and also communications to understand the benefits of good healthcare, but also good prevention. Those, in many cases too, they're very much influenced by powerful forces, whether it be the tobacco industry or others, whether it be the inequities that we see in society. Why is it that particular parts of society experience much worse health outcomes from causes of death or causes of disease that are entirely preventable? So as I've become to, I guess, understand myself a little bit more, I know that I'm very motivated as a leader by values, values around fairness, values around equity, values around empowering people to achieve the best outcomes for them and people around them. So I think that's been a very important influence on some of the the career choices that I've made, and also the work within those leadership roles that have been particularly important to me.
So, okay, so I'm starting to get a good picture of you here, Todd. So I've got the deeply curious, remains open to opportunities as they come up, flexible, can kind of jump to take advantage of things quite quickly. I guess what I would love to hear then is, what was your first entree into the sector, and how quickly did you start getting opportunities to step into leadership roles?
Yeah, so my first, I guess, leadership role as CEO was with the Tasmanian AIDS Council. So this was in the 1990s, in the early days, the very challenging period of the HIV/AIDS epidemic in Australia. There was no cure. Treatments were still many years away, and really all we had was supporting, providing emotional support for HIV/AIDS patients and prevention. And it was one of the most powerful influences that really shaped how I thought about prevention and the opportunity for collaboration, connection with others. So in the early days of the HIV/AIDS epidemic, we saw a remarkable piece of leadership within Australia. We had gay men, injecting drug users, sex workers, and others who were really at the epicenter of this epidemic in its early days, coming together around a common course of action to advocate for policies, programs, communication campaigns that that they could all stand behind and advocate for, and they did that so well. So much so that Australia was and is one of the world leaders in HIV/AIDS prevention. It became a blueprint for other countries to follow. So that was a very powerful reminder to me about what advocacy could achieve, the benefits to society, the health outcomes that could be achieved. And those influences, I think, have very much stayed with me in subsequent roles that I've had in tobacco control and cancer, where we've faced similar challenges to prevent more deaths occurring and to develop the case for action in a whole range of areas, from smoke-free restaurants, smoke-free bars, reforms in screening, reforms in patient care, reforms in research. Those influences, I think, really stuck with me from those early years.
Mm. How did you get that CEO opportunity? And when did the potential of the fact that you could be a CEO, when did that first come onto your radar?
Yeah, so I'd taken a leadership role at the Tasmanian AIDS Council, and the CEO at the time took another post, and he was very encouraging of me to be a CEO. I'd never thought of myself as a CEO, but I was comfortable with the content area, and I'd spent a little bit of time in there to understand, I think, that what the opportunities might be, and I appreciated that I'd have to work on some of the deficiencies and lack of experience that I had, but I was prepared to give it a go and I had encouragement from people around me to do that. And I think that was, it was a really valuable experience to probably start in a CEO role in an area that provided some familiarity with the content.
Mm. So are you now on your third CEO role? Am I right? Or
So I went from that to head of QUIT, then to head of Vic Health, and then to the Cancer Council in my current role. Yeah, so there's been very, very different. So there's government organisations, obviously with Vic Health, as well as not-for-profits. You take something out of all of those roles, I think, and none of us, I think, when we step into those roles are perfectly suited. We have to be curious, we have to learn, we have to accept that we have vulnerabilities. We may not yet know them all, but we have to be on a journey of curiosity and discovery to be the best that we can in those roles, and to recognise the resources that we have available around us, the people in the organisation who can help to shape, I think, some of the leadership that I or others might take in those roles.
Do you remember? So we've got 4 CEO roles. Are you getting better at being a CEO at each opportunity?
Yeah, look, absolutely. And I remember, struck with me a conversation, if I can turn to sport briefly, where for a long time it was the case that if you failed first time as an AFL coach, you would never get a coaching job again. And it's only recently that we've started to see a little bit of that turn, because I think we should become better leaders over time, because we all make mistakes. None of us are perfectly formed as leaders, and we're certainly not in control of the external forces that are around us. So being vulnerable, being prepared to recognise that you make mistakes, and being open about that journey that you're on with others, I think helps to shape our ability of leaders. I've become, I think, much more understanding of when things don't go right. And there's a real tendency, and I probably had it as a CEO, when things don't go right, you probably look for what went wrong. What happened here? And I think you even see it in some leaders, a temptation to look for someone to blame. But I think in those moments, they're some of the richest opportunities we have to learn as a leader. And I've seen in various situations people around me, when something goes wrong, they're really horrified about the consequences and might happen next. And so I try, and wherever I see that, use it as an opportunity for growth. That person feels bad enough about the mistake that they've done already. They don't need me to tell them that. I need to be there to help them learn from it, grow from it, and feel confident that they're in an organisation and they're surrounded by people who respect their abilities and focus on what they can do, rather than the odd occasion where things might go wrong. And that's challenging, I think, for leaders to do that sometimes.
I've got a few questions about that. One of the first questions I'd love to ask you is, just generally in your career, is there some feedback you got along the way that stands out as maybe hard to hear at the time, but was important that you
Yeah.
heard?
Oh, yeah, absolutely. So I think one of the things that I've had feedback that people appreciate working with me for my ability to see opportunities and to communicate a vision for the organisation. But what I was making the mistake of too often early in my career was that I then wanted to get into the detail of doing it all. And that's, and I've come to learn of how disempowering that can be, because I'm not using the strengths of the people around me. It means that I'm holding too much. And so I really had to think very hard about that, of what is it that I can do to assure myself that that's happening, the work that needs to do is happening. But I want to build up the capacities of the people in the organisation I'm in to be able to step up and take responsibility. If I'm doing that work as well, I'm not going to do it as effectively as they would, and I'm not developing a long-term capacity in the organisation to take those issues forward. So that's been one of the lessons that I've certainly learnt along the way.
Did someone give you that feedback, or did that come out of sort of self-awareness?
A little bit of both. I'd sought that feedback from others about, what were my strengths as a leader and what did I need to work on. And it took me a while, I think, to sort of really get into that and feel as though that I'd addressed it, because it is quite challenging for a leader, I think, to be comfortable to put that trust in others, and to because at the end of the day, there are so many things that can and do go wrong, often through no fault of anyone. But often CEOs are accountable for what does go wrong, and so there is an understandable anxiety, I think, about that. But the more I trust, the more I set a strategy, the more I involve others in that, the more comfortable I've become. And I think actually the better the leaders around me have become, because they take on that shared responsibility, and they feel motivated by the opportunities that come along. They appreciate the trust that is shown in them by myself and leaders in the organisation.
How do you get, I know the CEO role, one of the things I hear a lot is it's really difficult to get unfiltered feedback. You start hearing what people think you might want to hear and stuff like that. How do you get unfiltered feedback about you now?
Yeah. So I think that can happen in a few ways. It can happen through those opportunities where you might specifically ask for feedback, and there's a number of obviously leadership tools that do that. I think part of it is also around developing a culture where people feel comfortable in talking about challenges, issues, what's going wrong, with not only me but their leaders as well, and having some of those awkward conversations. I think if you're having those awkward conversations and it comes from a position of trust, people recognise they're not being judged in the moment, but their views are genuinely sought. I think people are more likely to be forthcoming and want to contribute. I think also, we all do organisational surveys. We have there's free text fields where you have the opportunity to provide feedback to the CEO. Thankfully, our people take up that opportunity. We're going through one of those exercises at the moment.
Yeah.
And I think also self-development, because sometimes when I'm reading things about leadership, it really strikes a chord and it prompts me to ask some questions that perhaps I hadn't thought of doing before.
It made me think of, I asked you a question before about some of the best leadership advice that you'd received. And one of them was to be willing to sit with the awkwardness rather than jump in and rescue people. I'd love to ask you about that.
Yeah. It's very tempting, I think, and I feel this temptation as well, when there's a difficult issue on the table, to jump in. You've seen this sort of thing happen before, and it's going to save time if I just say this is the answer. But sometimes if I don't jump in and sort of look around the room and encourage people, then a few things happen. One is that people start to feel more confident about contributing. It becomes useful as a data gathering exercise as well, because if you've got good leaders around the table, then they'll contribute perspectives that I hadn't thought of because of their experience. But there's another thing that happens. It helps to build a more resilient leadership structure that doesn't rely as much on the CEO. CEOs have got a short lifespan, so I think we really need to be thinking about what happens after I've gone. Is there a resilient organisation, leadership structure, leadership capabilities that I'm helping to develop? And those awkward moments are often some of the richest conversations that we can have.
So I want to ask as well, what surprised you about the CEO role? And I guess you're on number 4 now. So often when I speak to CEOs, they can recall their first day, week, month as a CEO. Can you recall that across all 4 jobs, or does one stand out more than the others?
Yeah, it's a good question. I actually often talk to about I can remember the first day of all of those jobs. Absolutely is the short answer to that question. And those early experiences, I think, are really valuable, because in the first 100 days, someone once said to me, you will see things in that first 100 days that won't make sense to you. The longer you're in an organisation, the more they do make sense. But it's often really valuable in that first 100 days, write down the things that don't make sense to you, and then come back to it once you've been in the organisation, say 100 days or more, and see if they still ring true. What are the things that you learn from them? But I remember my first day as head of Cancer Council, as CEO. So I was coming back to the organisation after 4 years away. And I did an exercise where I invited 4 or 5 people from different parts of the organisation to come and meet with me, and I had a few questions for them about what they thought was working well and what they thought that I could contribute to, similar sorts of questions that many would ask. And so there was a few things came out of that. One, it struck me that there were people across our organisation who'd never met one another, and so it spoke to me about the opportunities to create connections as a way of building innovation in the future. Mm-hmm. It also struck me that I asked people what they thought, what were the values of Cancer Council, and nobody knew, not even the people who worked in HR. And when I explained to them what values are, and so I asked them what they thought the values might be, and almost universally they described the 3 words which would become our values: excellence, integrity, and compassion. And so to me that spoke to a very powerful operating system, if you like, of the Cancer Council. Things that were true to the organisation, that were very powerful motivators, and the way that we could have a significant impact on cancer control. So they've become our values. They were, I guess, informally, but it really helped to, I think, embed from an early time in my role as CEO of Cancer Council, how collectively we were going to work together to achieve our mission in cancer.
It's interesting that you say that, because you often hear that, an organisation will have a culture whether you're deliberate about it or not. So yeah, it's nice in some ways that there has been that potential deep match across the organisation with what those values are.
Yeah, absolutely. And look, I was fortunate to step into the organisation after a very distinguished leader who'd done a great job, and so I could see the impact in that, from that leadership in the culture of the organisation. But I think it's one of those. I took the opportunity to work across the organisation to really embed that. How do we live that? What are the opportunities to also empower people in our organisation? So if they came across a situation where perhaps they may not be sure how to proceed or what the organisation might think, I learned that if we could be very clear on our values and be very clear on our purpose, it actually empowered people, that they felt confident in stepping up. They felt confident in speaking to a particular issue or understanding how to proceed with a particular issue, even if they were hearing it for the first time, because they understood what was important to the Cancer Council and the way that we wanted to operate as an organisation.
What would you call out as the hardest thing about being a CEO?
Oh, that's a good question. I think one of the most difficult challenges in being a CEO is being in a situation where you don't have control. The external environment has changed, or there are factors that have emerged, issues that have emerged, and you don't have line authority, or you don't have a delegation. And what do you do in those situations? It might be that relationships have broken down, or a shock has happened to in your environment. I think they're some of the most challenging issues, because as CEOs, we are often in positions where, as leaders of the organisation, we do have authority, autonomy to with certain leaders. So I think they're some of the most challenging issues to deal with.
And let me ask about the good old chestnut around imposter syndrome, whether the terms still popular or not, I think we can all understand that feeling of questioning ourselves. Am I really up for this role? Have you ever felt imposter syndrome along the way?
Uh, almost, yeah, almost every day, really.
Yeah.
Um, but I've also come to appreciate that if we don't have imposter syndrome, then I don't think we are really tapping into our leadership strengths, because there is so much complexity around the role of CEO that I don't think any of us can be perfectly formed or have finished being formed. So I actually would be more suspicious of people who don't have imposter syndrome. I think imposter syndrome is something that we can use to develop, recognize where we might not have all of the answers, recognize the strengths of those around us who can contribute, and having that vulnerability to talk about that. And that actually invites others into the discussion, into the conversation. And they're some of the richest conversations, I think, as leaders that we can have.
I want to ask you now, just when it comes to strategy, I know from experience as a CEO, there's so many things to fix or address or improve or whatever.
Yeah.
How do you narrow that down? How do you work out what the critical issues are that you need to focus on, Todd?
Yeah, absolutely. And cancer, of course, is one of those areas, right? It's so enormous.
Yeah.
So one of the things that I was keen to do when I started as CEO, I looked at some of the lengthy strategy documents that have been prepared. So I set the organisation the task. I said, look, I'd like to have a strategy on one page. The more we cram into this strategy, the more it dilutes something else in the strategy. What are the things that we really want to elevate? And over time, we became very focused on where we can make the biggest impact in cancer and what we needed to do to achieve that. So whether it be in advocacy, policy, funding, communications, using those taxation, law and regulation, using those big levers that we have available to achieve big outcomes in cancer control. I remember a really important lesson. I was fortunate enough to attend a strategy session at Harvard many years ago. And I remember a really important lesson. It's just as important to be clear on what you're not going to do,
Absolutely.
because that frees up capacity to do what you're really good at. And so that have been through that as an exercise with our organisation. And so I think it really led us to then focus on some big opportunities, whether it be a bowel screening or seeing big declines in lung cancer through tobacco control, whether it be one of the new ones that we're really facing at the moment is liver cancer, almost entirely preventable, but with very low survival rates. What are the things that we can be doing here? So I suppose you're using some of that economics training. Where do I get best value for the investment that I'm putting in? And I think that helps to really align the purpose and be clear about a vision that excites and motivates people in our organisation, and also ensures that we can be achieving big things. So one of the things that we excluded, for example, Melissa, was not including a timeline and not including geography in that high-level strategy, because some things like the achievement of plain packaging for tobacco products, that doesn't fit within the life of a 3-year strategy. That was something that we adopted many years ago, recognising that it might take 10 or 20 years for us to achieve it. But if we did, it was going to be worth it. So that was one of the things that we did. And then geography was important because we wanted to be not only pulling in knowledge from around the world, but we wanted to be sharing knowledge around the world. And so we didn't want to just be focused on Victoria. Victoria, where I'm based, of course, that was going to be the big beneficiary if we were successful. But I wanted us to be thinking about those global opportunities to engage as well.
That's amazing. I wanted to ask, I mean, you would have an enormous group of stakeholders that you're working through. How do you navigate that? How much of your time personally is sort of spent in that space?
Yeah. Well, I think all of us at Cancer Council in one way or another are doing that work. So I certainly do a lot, but I see it as something that's very much shared. So if you think about cancer, 1 in 2 of us diagnosed with a cancer before the age of 85, all of us are going to be affected in some way as a carer or whatever it might be. If you think about the community organisations, research organisations, carers that we are involved with, it's something that affects all of us. So I can't do that alone. What we try and do is to really emphasise at all levels of the organisation how critical those partnerships are. Sometimes we'll be leading, sometimes we'll be supporting, but wherever possible, hoping to align with our stakeholders. And if I think of some of the advances that have been made in cancer or even in HIV/AIDS, or when I was working at Vic Health in preventing violence against women, all of those were shared responsibilities. But what we did have, as much as possible, was an alignment about what was important, what we needed to achieve to be successful. And then hopefully what that does is provide a space for everyone within our organisation and outside to be contributing to this very powerful opportunity that might exist.
Given the work you do on the Cancer Council, what message does this audience need to hear? If you had one wish, what would we all know and what would we all do?
Oh, in leadership or?
No, just to do with the work of Cancer Council Victoria.
So we're very much, so I think of Cancer Council Victoria as a knowledge organisation. We invest in research to create new knowledge about what's going to improve cancer prevention, early detection, support for patients. We also want to use the best available existing knowledge. So that's why it's important, as I mentioned earlier, to be globally engaged, getting the best information wherever you can to put that knowledge to work. We put that knowledge to work in a few ways through advocating for new laws, policies. It might be taxation reform, communications programs, etc. And then the final step in that, being a cancer knowledge organisation, is to evaluate how effective have we been. And we do that in a few ways, by measuring cancer incidence and mortality, or even measuring what specific programs like our QUIT program or SunSmart program has achieved in changing attitudes, knowledge and behaviour. And then you use that information to start again and be continually acquiring and putting into place cancer knowledge, which will ultimately achieve what our mission talks about, which is prevent cancer, empower patients and save lives.
You work in, understandably, a very detailed and probably at times very confronting area, sitting across so many sort of health challenges that you're addressing. How do you take care of yourself, Todd?
Yeah, it's a good question. And I don't think I've always been great at that. I think I've had to get better at that over time. So for me, I think it's recognising that to be fully invested in the work, I need time away from the work, both physically and psychologically, for want of a better description. If I'm doing that, then two things happen. It gives me a chance to sort of step back and look at the broader perspective, because often I'm in the treadmill of what I need to be doing on a daily, weekly basis. But having that opportunity to step back, it does give me really valuable insights and new perspectives. The other thing that it does is enable our leaders to step up. They when I'm not there. But it also gives me the opportunity to recharge, and because I think in CEO roles they can be demanding emotionally, physically, psychologically, so many things. And so I've got better, I think, over time at accepting that that's what it is, and that if I'm going to be the best version of myself, I need to look after myself. So that's being away from the office. For me, it's also riding a bike. I try and do that pretty much every day.
Yeah.
And that gives me an opportunity not only around physical health, but it's how I can socially connect with others as well. And I've often told people that there's nothing so un-CEO-like, right, as being in Lycra. You know, that's the great equaliser, I think, for people around me. So what I do in my work doesn't so much matter when I'm on a bike.
So should people aspire to become CEO? Like on balance, I read an article last night that came out saying, and I think it was from Corn Ferry, but it talked about the fact that it's getting harder and harder to find people who want to step in succession planning wise into the CEO role. What's your take?
Yeah, that's interesting.
Mm.
I haven't. It might depend on sectors and organisations. So I often think about that succession planning piece because we should as CEOs, because the lifespan of a CEO is only a few years. So we should be thinking about what comes after each of us. I can see why people would find it incredibly challenging. So aside from the cancer business, we have to grapple with some of those big challenges that affect all other organisations. The impact of cost of living, the threat of AI, security, recessions, etc. So I can certainly see why that happens. And we saw in the pandemic, we keep being thrown challenges around new things that are happening around us. I think one of the things that helped me, and I think helped our leadership team adapt to that, was to pretty much put in place or recognise that change is going to be a constant. It's not going to be something that happens maybe every few years. It's constant. How do we deal with that? How do we create a more shared leadership approach that supports one another, supports the issues, brings together the expertise that we need? And hopefully what that does is give people in the organisation confidence that when I step away, the organisation will be able to continue, and there'll be people in the organisation who would be willing to step up into that role because, in a sense, they've been participating in it while I've been in the chair. But look, I can absolutely appreciate the challenges. They're significant, and that's why I think it's great to ensure that you're tapping into the expertise around you and not see the role as just being about you. One of the things that I think I've found is that the more humble I am as a leader, the more effective I am as a leader. And as CEOs, it's not always easy to be humble, and I probably tick that box as well. But doing that, I think, does provide the opportunity to bring others into the problem-solving challenges that CEOs face.
I can add self-reflective then to the list of characteristics that I described you as earlier. So, Todd, I've got a million more questions, but we're simply not going to get time for them today. But I would love to ask you the final question I ask everybody, and that is, what does brave feminine leadership mean to you?
So, Melissa, I asked a few of our female leaders in the organisation, and they said to me, "Do you mean brave female leadership?" And I said, "No, brave feminine leadership." And I thought, "Oh, that's very different." You realise? I said, "Yes, I realise."
Yes.
And so and then we got into a discussion around masculine leadership and as well as feminine leadership. And one of the things that was a common factor in those conversations was describing some of the perceptions that we might have around masculine and feminine leadership. And I think what we were describing, of course, these are stereotypes, I stress, that for men, it's often a case of leading by instinct, having to be right, make an early call, whereas some of the best aspects of feminine leadership, I think, are more wanting to bring people into the discussion, bringing people along to with that approach. And I actually think that brave feminine leadership is also about being accountable. Like, I'm going to speak up about issues, but I'm not just going to speak up about issue and then leave it. I feel some accountability to be there for the solution as well. One of our leaders described, she said, I think that we do this in the organisation. And I said, what do you mean by that? And she said, we care for the work and we care for each other. And I thought that is just so incredibly powerful. It recognises, I think, one of the great strengths that, on balance, I think women exhibit more in an organisation than men. It's often harder for men to do that. But fortunately, I've been surrounded by a lot of really wonderful leaders, female leaders in our organisation. We're about 85-90% female. And the more I see of the contributions that they bring in terms of empathy and being so invested in not only the welfare of the organisation, but the welfare of each other, those are traits that I really cherish as a leader, and hopefully I'm getting better over time at exhibiting that about caring for the work and caring for each other. Thank you for the question.
What a beautiful response. And, gosh, I'd love to, I can picture you all sitting there having that really incredible conversation. And what a brilliant reflection of the organisation as well. It's been such a pleasure having you as part of this conversation and for you to share with us parts of your journey and insights into the role. Thank you so much for joining the conversation, Todd.
Thank you, Melissa. I've really enjoyed it.